Hello everyone, my name is Jessica Batres, and this presentation is on the two-dimensional analysis of the narrow stance squat. Before we dive right in, I just want to give a quick overview of this presentation. First, we'll start off with the purpose, then we will get into the literature review, followed by the procedures, data, results, and the conclusions of our study. The purpose of this study was to analyze the kinematic components that make up the body weight squat. Squats are a common movement in training, from athletics to powerlifting, occupational settings where manual labor is involved for lifting, and rehabilitative care after injury. As this is a compound movement, meaning that it is a summation of different joints and angles working together, the complexity of this movement is usually underestimated. The understanding of each component and its biomechanics is critical to not only prevent injury, but optimize performance as well. One thing to consider for squat performance would have to be the squat stance, as the variations have different impacts on the body. In the literature, McKean and Burkett 2012 and Demers et al. 2018 focused on segment length, and they found that the ratios of the trunk and shank caused for higher knee angles when performing the squat. The 2012 article found that taller women typically achieved greater knee angles as they tried to keep their back more erect and utilize their knees more to perform the squat, in comparison to taller men who achieved smaller hip angles as they tried to compensate for the lack of knee flexion. They did an excessive forward lean. And this is due to the fact that a deep squat requires a smaller knee angle, making it more difficult to achieve when the moment arms are longer. This leads me to my next point that was found in the literature where Almaznino et al. 2013, Lorenzetti et al. 2018, and Escamilla et al. 2001 found that the stance width and foot rotation combined had an impact on the joint moment components. Both Escamilla and Almaznino found that a wider squat stance resulted in a greater moment arm, while Lorenzetti found a decrease in knee displacement. Now, most of these articles conducted their studies on healthy young individuals and found that there was no significant difference on stance width. And so because of their restrictive research sample, it's difficult to generalize it to the general population. And after looking at this literature, we asked which one would be the most optimal for our study. So concluding from our research, we opted to go for a shoulder width stance with parallel feet for our study. Moving on to the methods and procedures, I recruited 6 participants, 4 of whom were women, 2 of whom were men, all between the ages of 18 to 35 years old, height between 1.5 to 2 meters, all weighing between 50 to 90 kilograms, and had experience with bodyweight squats prior to this test. Per the protocol, subjects performed a pretrial test to perform the bodyweight squats without compensation. Compensation for this study is defined as a lower back arch, low back round, excessive forward lean, and arms falling forward for an overhead squat. If the participant was able to perform the bodyweight squat without compensation, they were able to move forward into the trials. And once the trials were set, 10 markers were placed on the subject's left and right side of the body in these specific parts: the lateral rib cage, the greater trochanter, the lateral femoral epicondyle, the lateral malleolus, and lastly, the second metatarsal phalangeal joint. The subject was asked to perform 6 total squat trials, 3 on the left side and 3 on the right side. The subject was to perform the squat in a 3-1-3 squat cadence to a metronome set to 60 beats per minute. So for the descent phase, it was 3 beats with a 1 beat hold, and a 3-beat ascension phase. Once the trials were complete, I conducted a data analysis using the tracker software. Following the procedures, we'll get right into the data. For this slide, I compiled the data for trial 1 specifically, looking at the 3 joint angles on the left side and on the right side of the 6 participants. And in the figure 4, we have the percent movement time versus left and right hip flexion in trial 1. In figure 5, we have the percent movement time versus left and right knee flexion in trial 1. In figure 6, we have percent movement time versus left and right ankle flexion in trial 1. And I chose to normalize the time because I wanted to get a good comparison between all of the participants and figure out which one would be the most consistent, which seems to be figure 4 of the left and right hip flexion. We see that the trials are pretty consistent throughout each participant in comparison to figure 6, which has more linear lines as well as more parabolic looking lines. For this data slide, we have the peak flexion angles of the 3 joints for the 6 participants over their 3 trials. I wanted to see if there were any individual trends as well as overall trends that would be significant for this study. And one thing I found interesting was that for the peak right knee flexion angles, one of the participants has a significant inconsistency in their trial angles, and in comparison to the other ones that were pretty consistent. In terms of overall trends, I thought it was interesting how the peak left hip flexion angles were pretty consistent for the individual participants. However, overall, it stayed within a small range in comparison to the peak right ankle flexion angles, where there is a higher range, where the lowest would be 60 degrees and the highest was 100 degrees. Coming to our results, the overall data was pretty consistent throughout the participants. However, there were a few discrepancies in the first slide of data of the right ankle flexion in trial 1. And in slide 2, we did see the discrepancies in the peak right knee flexion angles. However, the sample size was really small, so it was difficult to really kind of generalize the data. Again, they were all healthy young individuals who had experience with bodyweight squats. So future research could conduct studies that have a diverse pool of individuals, whether that being a random sample size or having control groups of healthy individuals, those who aren't as active, and so on and so forth. From collecting and analyzing data throughout the semester from home, I really learned a lot about how much effort and research it takes to conduct a study like this, because I've never participated in one of this length before. My favorite overall part of this study was being able to use Tracker to analyze joint angles, because it gave me more experience to work with data and software. The toughest part would definitely have to have been working with the data itself. I never worked with such a large data set, and so it was kind of a challenge coming up with the graphs and kind of working with those. And for real world and clinical applications, just being able to simply record and analyze the movement really allowed me to get a better understanding of what I need to know in order to help others as well as myself to perform different exercises better or more optimally. Possessing the ability to analyze these movements is critical for injury prevention and optimal performance, as many movements or even certain Components of movements can be transferred into many different settings. Like we mentioned earlier, we discussed the um, importance of it translating into athletic training, occupational settings, and rehabilitation. And that's all for my presentation. Thank you so much, and I hope you enjoyed it.